got through this. Easy for listening. I was able to do it. Easy for dancing. I'm not a great lover of cats. That's my fear.
You're a disgrace, you are.
Not me. That's my fear.
You're a disgrace, you are.
Hello and welcome to One-on-One Shadowboxing, Have Your Say. Today my guest in the studios of W Television is Rob Astbury, and you are the CEO of the West Australian Association of Mental Health.
Correct.
And what else are you doing with mental health? I know you are involved in several layers. Tell us about your other two positions, which are also important.
So the WA Association for Mental Health is one of 8 peak bodies around Australia, and the national peak body is called Community Mental Health Australia. So another role I have is a convener of that group, and also I'm part of the Mental Health Advisory Council, which provides advice to the Mental Health Commissioner about mental health policy and
That's in
community
WA.
issues. That's in WA, that's correct.
So start with the peak body. How many members the peak body's got, and what sort of representations you can make through that body?
So we have around 150 members, and our
They are
membership...
all organizations, or
They're a combination of both organisations and individuals with mental health issues. We represent both organisations that provide community services to people with mental health issues, but also people themselves.
and all these organizations are non-for-profit
That's correct.
organizations?
That's right.
So no government involvement
That's
as
correct.
such.
That's correct.
And what is the activity, the main focus activity of the WA Association of Mental Health? What are you doing in here?
So there are 2 major areas of focus for us. One is the area of policy, which is about providing advice about mental health issues.
Yes.
And as part of that, we also provide training and support services to organisations and government departments and so on about mental health. The other area of focus for us is mental health promotion, which is about promoting positive attitudes to mental health in the community and helping people with mental health issues to access the support they need.
Rod, seems to me, this is just my opinion, mental health is in the past 5 years, in the 21st century, became sort of buzzword. What do you think was the reason for that?
Well, I think people are starting to talk about mental health issues, which historically people haven't done because there's been a lot of stigma about mental health. So there's a lot more awareness of how important good mental health is in the community, and people are more willing to have conversations about that than they have been in the past. So we're starting to see some of the stigma around mental health falling away, which is
Such
well
as?
overdue. Well, one of the areas that's very evident is in workplaces, because employers are recognising now that problems of productivity and absenteeism and presenteeism, which we also see, because of poor mental health is affecting workplaces. And they're seeing that having a constructive approach to mental health makes a difference to their business. So what we're seeing as a peak body is a lot more employers wanting assistance in how to help their employees to deal with mental health issues and how to make sure that their workplaces are positive places for people to work in.
So what is the involvement in today's care of mental health from the psychological institutions and psychologists? Because seems to me in WA, lobotomy is still an issue, and also electric shocking is an issue for treating mentally ill people on a short or medium base. Is that changing? Because that's going back centuries now. Is that sort of crude treatment, so very crude treatment for mental institutions for the patients?
Yeah, well, certainly lobotomy is no longer practice, so that doesn't happen anymore, thankfully. And electric shock treatment is actually effective for some people, and so it's quite controversial.
It is.
But for some people, in the right circumstances, it actually does help them, particularly with depression. I think the main thing that's changed in terms of approaches to treatment is that there's more of a focus on treating people earlier and making sure that people get assistance to live well in the community rather than having to be admitted to hospitals for acute treatment when their problems are very severe. So there are more community-based services now than there have been in the past, which is good. And still a long way to go in terms of having enough services for people to get help early on and to be able to live in their own homes and be supported in the community than there has been in the past.
And how does government help the mental health or help maintaining mental health in Australia or in WA? Because government's cutting back supports left, right and centre from the health industry. How do you feel that influences mental health and the treatments?
It's a long-term problem in mental health that there hasn't been enough services funded by government or funded by other sources of funding either. So it's not only government that can provide resources for mental health, but traditionally that's been the role of government. What's changed, I think, is that, and the major problem has been that where the government has put money and support in has been into the most severe acute end of the treatment spectrum. So it's been a matter of having the ambulance at the bottom of the cliff is the way we describe it. So it's acute hospital beds, and what government is focusing more on, which is a good change, is trying to get more resources into community-based services. But that's a long and difficult process.
Is this not just passing the bucket to the community and saying we're not prepared or we not have the resources, so the community have to do more?
I think there was a phase in mental health 30 years ago when that definitely did happen. So there were a lot of institutions that were closed without adequate community supports being available. So that was the era when the asylums were closed. But I think we've still got a major challenge for government because there's never enough money and resources are tight. But I think it also reflects that lack of investment in mental health services, though, reflects some of those stigmatising ideas and negative stereotypes that the community's got, because it's harder, it seems to be harder for government to find resources to put into good mental health treatment services than it is to put into cancer or treatment for heart disease, for instance. So I think as the community attitudes change and people expect better services, government will follow that, and there's still a long way for government to go to find enough resources.
So how many hospitals currently in WA looking after mental patients, or how many beds we got in statewide?
The majority, so most of the larger treatment hospitals have a mental health ward or department as part of their operation. So we only have one specialist mental health facility called Greylands still open, and that's signalled to close. So what's happened?
Signal to close.
Yes. So
how many beds in Greylands?
I really don't know. It's somewhere over 100. Is my memory of it, but that's so it has been getting smaller, and it is better that people can get acute treatment close to them in their local hospital rather than having to go to one place in Perth. So there has been that's been an important change, that where beds are needed, they're located in local hospitals, and
so the beds are going to be redistributed in the local hospitals.
And that's the last of them. There aren't many of them left, and the ones that are still there will be over the next 10 years. And then, so in terms of the total number, I don't have that figure in my head, but what the plan for mental health says is that the number of beds is about right. So the number of acute beds is at about the right level. Where there's a real shortage of resources is in the other sorts of treatment. So accommodation support for people, early intervention, treatment for people, community-based supported living for people. So that's the area where there's a shortage of supply.
And how do we go with professionals, doctors, psychologists, nurses with mental health, in the mental health section of the health?
Well, there's all those competition for those specialist people with those skills is quite strong, and so there's a constant need to be training more people with specialist skills, and from time to time there are shortages. So there's a workforce planning focus that's really important in mental health. That's happening all the time.
What's the reaction of the government or the different political parties? Or it's not a political party issue, it's a bipartisan or above the line issue for all politicians?
What we would say is that neither. We've had various governments that have been in power, various parties that have been in power in government over a long period of time that this law's applied that have not fixed it. So we are hoping that there will be some positive change, and we're hoping that the election will be an opportunity for us to
next
get a
state
good
election.
That's right. The state election is a time when we'll be seeking all four parties that are contesting the election to be very clear about how they're going to fix the problems with that law.
And which party is more sympathetic?
Because at this point?
At this point.
It's too early. I mean, we're still getting responses, and because the review of that act is only just reported, it's too early to have the government's position. So we're still waiting for that, but it's an issue we'll be highlighting in the lead up to the election.
But the Greens are not championing.
The Greens have a position on it that's certainly seeking some big reform, so that's encouraging. The Labor Party recently made a statement about them wanting to reform it as well, so we're feeling a little more optimistic, but we won't be letting the issue go in the lead up to the election.
On that note, Rod, we have to go to a short break, but stay with us, please, because after the break we're coming back with Rod, more discussion on mental health issues in WA. Hello and welcome back to One-on-One Shadow Boxing. Have your say. Today my guest is Rod. Rod from the West Australian Association of Mental Health. Rod, we talked about different responses and responsibilities of the society in regard to mental health in the first half. And we're still continuing talking about the issue of mental health, obviously, and some of the causes of mental health and some of the myths of mental health and the reality. I heard that from my grandma. She used to say, healthy body, healthy mind. Is this true?
She was right.
Is it true?
Very smart.
Or healthy mind create healthy body? Which one? I didn't ask her about that, but that's what she said.
She was onto something, though. Yes, there's no doubt that looking after your physical health will help your mental health, and that's well supported by extensive research and evidence. And so the answer to your question, which is true, I think, is that they work together. So there's a systemic thing that happens here, because if you look after yourself physically, you're more likely to feel positive and happy. And anyone who's been unhappy and depressed knows how hard it is to stay physically well and to look after themselves well. So it's a good idea to look after yourself and your physical health because it'll start that virtuous circle that happens with systems, and it'll certainly contribute to you having a mentally healthy lifestyle as well.
Looking at our surroundings, alcohol and drugs, not just ice, how do they contribute to mental health? Because some say marijuana is good for health time to time, not abused, and alcohol is good for health, not abused. So how can and why the society can mismanage these two issues completely and not really taking into consideration the reality?
That's right. Our attitudes to drugs are really important in mental health, and there's a very strong correlation between poor mental health and misuse of alcohol and other drugs. And what's understood about that, again, is that they work in a systemic way. So on the one hand, using heavy levels of alcohol and drugs can certainly contribute to severe mental health problems. And what we're seeing around ice is a good example of that. And there's also evidence that that heavy use of marijuana is a big risk factor as well for mental health problems. So that's one side of the picture. On the other side, often people who are experiencing serious mental health problems use alcohol and other drugs as a way of self-medicating and managing their state of mind. So, and that's usually a negative, has a negative result. It's not they're not good things to use to try to cope with depression or other problems. So, or anxiety. Often people, when they're anxious, turn to alcohol or drugs to manage, and really they're not very effective.
But also we got these, the pharmaceutical industry is producing lots of sort of legal drugs which are based on illegal drugs, and they are bumping into and pumping into as a treatment for even if you couldn't sleep, even if you're anxious, you're excited, you got other problems in your life, just take this pill, that will solve your problem. And those are destroying also life. So is the mental health system experiencing the negatives of not just alcohol and drugs, illicit drugs, but recently, illicit drugs?
It's certainly true that the use of drugs that are specifically for mental health issues, like antidepressants and antipsychotic medication and so on, can be effective and help people. But it is really important for them to be used in a very aware way and informed way, because there are problems, potential problems with them to do with side effects, dependence. Some of them
hooked on by doctors, not themselves necessarily. So what we can do about those
really
things?
Important for people to be well educated about and informed about the positives and the possible negatives of medication that might be being recommended for them. And really important for people to be involved in the decision making about what medication is going to work for them. And really important for people to be aware of the many other things that can help them to lead mentally healthy lives, because over-reliance on one approach to feeling positive is a trap too, particularly in the area of medication. So if we're too reliant on pharmaceuticals to keep us feeling okay, in the long run, that's not good for our mental health. So we encourage people to think about their relationships, their work and how they occupy their time, their everyday life, how their everyday life can make them feel positive and healthy, because just relying on medication is not a solution.
We're hearing from the society lots of experimental sort of way to intervene in mental health issues. For example, one of the last thing is singing. Singing makes you sane in an insane world.
Whatever works.
Whatever works for whoever. But also sports or being basketball or any other thing. That became really important to help on people. But we also got this negative side of more and more kids in schools diagnosed with this unfit status. Who can help on those kids in school? Or how the school system is treating mental health issues? What's your opinion and experience?
Early education about good mental health and good physical health is really important. So from our point of view, schools are really important places to be giving good information and advice to young people and encouraging young people to live mentally healthy lifestyles. And as you say, part of that is helping them to live physically healthy lifestyles, because as we just talked about, good physical health leads to good mental health. But the other important messages for school children is about making sure that you feel able to ask for help without feeling that that's an admission of you being weak or that you're a mad person or that there's something wrong with you if you're experiencing distress, and encouraging young people and teaching young people how to support each other, because it's really important for people to know that if someone who's unhappy and feeling depressed has an ear from a friend to listen to them and to encourage them and to support them, that will make a big difference to that person's mental health.
Commit and belong.
Yes.
In a way.
Yes. Commit, belong. Belong's about relationships.
Yes.
And commitment is about doing something that makes you feel good. And we can all do that.
To finish it off, Rod, I just got a question for you. Can you name 3 myths about mental health and the reality?
Happy to do that, because there's still quite a lot of myths around.
Yes, so let's start with one and finish with the third one.
Yeah. I think one of the most damaging ones is that if you're feeling unhappy, it's a personal weakness and you need to pull your socks up and get going again. That's very damaging for people because it discourages them from seeking help, and they really need to be helped as soon as possible. There's a bit of a myth too, I think, about the only people who can help someone with a mental health problem are people who are experts in mental health. And as we just talked about, actually friends and family can make a big difference just by listening and being supportive and giving people hope.
And the third one?
I think the third one is that people with mental health issues are violent people who you need to be scared of, because the truth is that most people with mental health issues are feeling very unhappy and are wanting help. They just need help in the right way.
Rod, thanks very much for being on the show. And please don't forget, next week, same channel, same time, one-on-one shadow boxing, have your say.
You're a disgrace, you are.
Not me, that's my fear.
You're a disgrace, you are.